जो आज से तकरीबन 5 साल पहले महाराष्ट्र स्टेट की नीट पीजी की टॉपर रही है, उसका टाइम टेबल क्या होता था और किस तरह से वो बच्ची प्रिपेयर करती थी और आज उस बच्ची की एक्टिविटीज़ कैसे चल रहे हैं वो हमारे मेडिकल के स्टूडेंट्स के सामने रखें।
अस्सलाम वालेकुम। ये बड़ा अहम मौका है शाहीन इदारा जात में यहाँ पर फिर से आने का। डॉक्टर अब्दुल कदीर साहब की ये जो एजुकेशनल मूवमेंट है, इससे मैं लगभग सन 2000 से जुड़ा हुआ हूँ। इन द ईयर 2000 इनके पुराने कैंपस में टीचर्स के लिए मेरा एक गाइडेंस लेक्चर हुआ था और तब से 19 इयर्स हम इनके साथ हैं। पूरे इंडिया में भी, आउटसाइड इंडिया भी कई ओरिएंटेशन प्रोग्राम जो हैं पेरेंट्स के लिए, स्टूडेंट्स के लिए, टीचर्स के लिए करते रहते हैं। शाहीन और डॉक्टर अब्दुल कदीर साहब की कहानी जो कामयाबी की कहानी है, वो कामयाबी इसलिए है कि बड़े इखलास, बड़े खुलूस, सेल्फलेस तरीके से ये खिदमत कर रहे हैं। उसमें अगर कभी बिजनेस ओरिएंटेड कभी उनका दिमाग होता कि पैसा कमाना है इसके जरिए से, तो आज ये इतना बड़ा एम्पायर जो है वो खड़ा नहीं होता। एम्पायर इन द सेंस वो इंडस्ट्रियल एम्पायर नहीं है, एक एजुकेशनल एम्पायर है। और ये कितने मुख्तसर से अरसे में एक फर्द वाहिद ने अपनी टीम के साथ मिलकर कई ऐसे फ्रंट पर जिस पर कई लोग नाकाम हो जाते हैं, उस पर बड़ी कामयाबी से बुलंद तरीन चोटियों पर अपना परचम लहरा दिया। पहले सीईटी आई थी, स्टेट लेवल की हुआ करती थी, फिर जो है वो ऑल इंडिया लेवल के नीट आ गई। कई अच्छे बुरे पॉजिटिव नेगेटिव रिमार्क्स आ गए उसके ताल्लुक से। लेकिन शाहीन ने यह काम ये किया कि उस पर माथा पकड़ के बैठने के बजाय एक माता पची ये की कि अब उसमें से हमारे बच्चे जो हैं, हमारे से मुराद वो बच्चे जो गरीब इलाकों से आते हैं, झुग्गी झोपड़ियों से आते हैं, जिनके पास कोई रिसोर्सेस नहीं है। और उससे बुरी बात यह है कि वो इन सारे अंधेरों की वजह से कोई बड़े बड़े ख्वाब भी नहीं देखते थे। शाहीन ने एक बड़ा काम ये किया है कि इन बच्चों की आंखों में आज ख्वाब झिलमिला रहे हैं। वो यूजी की सीटी में, पीजी की सीटी में वो कामयाबी हासिल कर रहे हैं। और एक ऑर्गेनाइज तरीके से एक सिस्टम ऐसा बना हुआ है। बड़ी खुशी होती है देखकर कि ऑल इंडिया लेवल पर कई इदारे आज यहाँ पर आकर उनसे तरबियत हासिल कर रहे हैं और वो बड़े खुले जहन और खुले दिल के साथ उनकी गाइडेंस कर रहे हैं, क्योंकि वो चाहते हैं कि शाहीन की ये जोत से जोत जलती रहे और मुल्क भर में ये तहरीक जो है वो चलती रहे। कामयाबी इन्हें इस तरीके से नसीब हुई है कि इस साल, गुज़िश्ता साल जो है, लगभग 305 बच्चे गवर्नमेंट मेडिकल कॉलेज में एमबीबीएस में सीट हासिल करने के में कामयाब हुए। ये बिल्कुल ऐसा ही था जैसे कि 3 मेडिकल कॉलेजेस खोलना, 300 सीट का मतलब 3, वो किए बगैर उन मेडिकल कॉलेजेस में अपनी फौज भेजना, अपने बच्चों को भेजना, यहां के कैंपस में इनको स्टडीज के साथ साथ सेल्फ डिसिप्लिन, भाईचारगी, यहां पर हर फिरके के, हर मजहब को मानने वाले लोग, हिंदू हैं, मुस्लिम हैं, सभी लोग हैं। हिंदुस्तान के कई नॉर्थ ईस्ट इलाके से भी यहां पर आके पढ़ते बच्चे पढ़ रहे हैं। एडजस्टमेंट कैसे करने का, हॉस्टल में मेल मिलाप के साथ में कैसे रहने का, ये जो चीज ये कहीं पर यूजी और पीजी सीईटी के साथ ये एथिक्स, ये वैल्यूज या और कहीं सिखाए नहीं जाते हैं जो यहां पर सिखाए जा रहे हैं। अल्हम्दुलिल्लाह इसी बिना पर इनके कई प्रोजेक्ट्स जो हैं, शाहीन के नए नए प्रोजेक्ट्स भी कामयाब हैं। आज उन्होंने जो ऑल इंडिया टॉपर है पीजी नीट के, अशरफ केसरानी साहब, उनको यहां पर मदु किया है। उनके वालिद साहब भी यहां पर तशरीफ रखते हैं। एक प्राउड फादर अल्हम्दुलिल्लाह कि भाई इतनी बड़ी कामयाबी कि ऑल इंडिया लेवल पर जो पीजी नीट है उसके वो टॉपर हैं, और उनके लिए अब सारे रास्ते, सारे दरवाजे खुले हैं, वो कहीं पर भी एडमिशन ले सकते हैं। आज वो अपने जो स्टडी के टिप्स हैं, फोकस करने के टिप्स हैं, प्रिपरेशन के जो टिप्स हैं, कौन से बुक्स, कौन से ऑथर के बुक्स कैसे रिफर किए, अपना टाइम टेबल कैसे बनाते थे, ये सारी बातें इन डेप्थ इंशाअल्लाह वो जो बच्चे जो आगे एग्जाम देने वाले हैं उनको बताएंगे। मैं अपने तौर पर जो बताना चाहूंगा, क्योंकि अल्हम्दुलिल्लाह मेरी बड़ी बेटी ने MBBS गवर्नमेंट कॉलेज से किया, MD बम्बई में गवर्नमेंट कॉलेज से किया, और MD में अल्हम्दुलिल्लाह चंद साल पहले जब रिजल्ट आया तो महाराष्ट्र के सारे यूनिवर्सिटीज में अल्हम्दुलिल्लाह मेरी बेटी ने MD में टॉप कर लिया, और उसके लिए 2 गोल्ड मेडल्स थे, दोनों के दोनों गोल्ड मेडल्स जो हैं वो उन्होंने हासिल कर लिए। उसके लिए जो हमने ये किया था, पहला काम तो हमने मुकम्मल भरोसा, एतमाद अल्लाह ताला के ऊपर कि यस, जब हम कामयाबी के लिए मैदान में उतरते हैं तो उसका अज्र और उसका फल बेशक वो देने वाला है, ये उसका वादा है। दूसरा ये कि मुकम्मल पॉजिटिव एटीट्यूड के साथ में हमने शुरू किया, नो इफ्स नो बट्स। 3 अटेम्प्ट लगाए, 4 अटेम्प्ट लगाए, कोई बहुत परेशानी में आ गया, आखिर छोड़ छाड़ के कोई और इसमें चला गया, कोई छोटा मोटा डिप्लोमा कर रहा है, मेडिकल लाइन ही चेंज, ये सारे जो नेगेटिव जो खिचड़ियां पकती हैं हर समाज में, उसको हमने कबूल ही नहीं किया कि ये हमारे दिमाग पे, जहन पे जरा सा भी असर न कर सकी। उसके बाद कमिटमेंट था हर हालत में कि बहरहाल ये करने का है। सिर्फ हार्ड वर्क नहीं किया, स्मार्ट वर्क भी हमने उसको बताया कि कैसे इसके लिए जो है स्मार्ट वर्क करने का है। जो अफसाने हैं, देखिए MD के फाइनल ईयर की बातें बता रहा हूं मैं। 4 पेपर्स जो थे वो रिटन टेस्ट थे, जो लिखेंगे उतने मार्क्स मिलेंगे, ठीक है। 4 जो थे वो वाइवा के एग्जाम थे, जबानी एग्जाम थे। कहीं कहीं पर ऐसे ही बस बातें आई सामने भी, जबानी एग्जाम में क्या होता है, ओरल एग्जाम में क्या होता है, कोई रिकॉर्डिंग नहीं होती है, किसी किस्म की कोई रिकॉर्डिंग नहीं है। अगर एग्जामिनर ने यह कह दिया कि इस बच्ची ने, इस बच्चे ने एक का भी जवाब नहीं दिया है, तो 0 मार्क्स ही मिल सकता है। हम पूरे भरोसे में था, क्योंकि मेरी बेटी मुकम्मल हिजाब में रहती थी, हमने कोई उस पर कॉम्प्रोमाइज नहीं किए। 4 अलग अलग एग्जामिनर थे। लोग जो कहते हैं कि मुसलमानों के साथ में पार्शियलिटी होती है, जानिबदारी बढ़ती जाती है, तासुब होता है, डिस्क्रिमिनेशन होता है, ऐसा कुछ भी हमने एक्सपीरियंस नहीं किया। चारों गैर मुस्लिम एग्जामिनर्स थे। मेरी बच्ची हिजाब में थी और सवालात जो पूछने थे पूछे जैसे भी हैं। जब रिजल्ट आए तो वो थ्योरी में भी पूरे स्टेट की टॉपर थी और वाइवा ज़बानी एग्जाम में भी पूरे स्टेट की टॉपर थी। मैं मैसेज ये देना चाहता हूं हमारे बच्चों को और बच्चियों को कि तासुब, डिस्क्रिमिनेशन एक हवा है और बिलफर्ज कहीं पर अगर 1-2% किसी को कोई एक्सपीरियंस करता भी है, उसका फार्मूला एक ही है कि तासुब का अंधेरा जितना गहरा है, अपने काबिलियत का उजाला उससे सिवा कर दो। तासुब या डिस्क्रिमिनेशन अगर x है तो अपनी काबिलियत को 2x बनाओ, फिनिश। और यही चीज हर जगह पर, हर एग्जाम में। डिस्क्रिमिनेशन ऐसे एग्जाम्स में कहीं होता नहीं है। आपकी काबिलियत बोलते आना चाहिए। वो नेगेटिव ख्यालात जहन से हमको निकालने हैं। ऑर्गेनाइज तरीके से अपना टाइम टेबल अगर बनाते हैं, उसको फॉलो करते हैं। बड़े बड़े ऋषि मुनि, बड़े बड़े स्कॉलर्स, उनके भी टाइम टेबल फेल हो जाते हैं। वक्त की पाबंदी, वक्त को अपने कंट्रोल में करना उनके बस की भी बात नहीं है। मैं स्टूडेंट्स से कहना चाहूंगा, आपके साथ भी ये होता होगा, लेकिन टाइम टेबल इज द बैकबोन ऑफ आवर स्टडीज। टाइम टेबल के बगैर आपकी पढ़ाई नहीं हो सकती है। टाइम मैनेजमेंट आपको आना चाहिए। हर एक के जो है वो एक दिन में 24 घंटे, 1 घंटे में जो है वो 60 मिनट और 1 मिनट में 60 सेकंड, हर एक के पास उतना ही टाइम है। एक को मैनेज करने को आता है, दूसरा हड़बड़ा जाता है, बुखला जाता है। उसका शिकार आपको नहीं होने का है। 100% कॉन्फिडेंस रखिए अपने आप में, अपनी मेहनत पे। तो इंशाअल्लाह जैसे आज डॉक्टर अशरफ ने जो मेहनत, जो कामयाबी हासिल कर ली है, ये एक मिसाली है। और ऐसी ही कामयाबियां सारे बच्चे हासिल करें, इसलिए आज वो आज शहर शहर जा रहे हैं, घूम रहे हैं और अपने कामयाबी का राज सबको बता रहे हैं। ये बहुत ही अच्छी बात है। मैं पीजी नीट के लिए एस्पिरेंट जो बच्चे हैं, उन सब के लिए ढेर सारी दुआओं के साथ मैं अपनी बात को ख़त्म करता हूं कि अल्लाह करे कि आप भी और साल दर साल इसी तरीके से हमारे बच्चे इस एग्ज़ाम में नुमाया तरीन कामयाबियां हासिल करें। शुक्रिया। खुदा हाफिज़।
डॉक्टर तमीम साहब वो अपना वीडियो में स्टेज लगे हैं।
As per schedule, डॉक्टर तमीम साहब यहाँ पे आना चाहिए था। किसी वजह से वो मसरूफ़ रहने की वजह से वो नहीं आ सके, बट ही हैड गिवन हिज वीडियो मैसेज। एक वीडियो मैसेज भी दिए हुए हैं, वो अभी जस्ट अलाउ में यहाँ पे प्ले करेंगे उसको। प्लीज़।
Hello friends, I am Dr. Thameem. I am Director of Bright Medical Institute, which is a franchisee of Bhatia Institute in Karnataka. I am going to give you a brief orientation about how to prepare for postgraduate entrance exams. So I think when you joined MBBS, many people thought that that is the end of the struggle, and after that, life is going to be wonderful. And it's not the case, as you all understand, that we still have a specialty to do and then a super specialty for many of you. So definitely the struggle is not over still. We have various exams that are there, and we have the most important exam that we have in our country immediately after finishing your MBBS is going to be the NEET exam. And we have some institute exams that are also equally important. And then in that we have Ames, PGI, NIMHANS, DNB, and JIPMER. So these are some of the other important exams that are there. One of the important problems that I've seen in people who are preparing for entrance exams is that they don't have orientation towards it. And this is very different from what we see in most parts of northern India. And as compared to that, in South, generally people start realizing about entrance exams once they finish their MBBS, and some of them during internship. And I think that's a little too late, because we need to understand one thing, that in India, without post graduation, about say 40 years back, I think without PG, people could have survived, could have managed. Just doing MBBS would have been sufficient. But things have changed a lot from those days till now, and now we know that specialization is an obvious thing, and most patients are aware that whatever problem they have, got chest pain, they'll not go to a general physician, they'll definitely go to a cardiologist. So overall, you'll realize that just with MBBS is going to be a very difficult task. And then imagine that many of your own classmates are going to become specialists, and when you need to go behind them doing rounds, it might not look that comfortable for many. So obviously the sensible ones are those who start preparing early. And what I mean by early preparation is it should start in UG period. And those amongst you over here who have finished your UG and finished their internship, obviously the day you start, that's the best day, and nothing is too late. But then definitely those who start early and those who start in their undergraduate phase definitely will have a huge advantage. Now, just to give you the orientation for PG entrance exam, remember that the PG entrance is a little different from how we prepare for undergraduate exams. In the UG exam, when somebody asks you a question in the board, tell me some cause of anemia, and you start telling those cause of anemia, this is iron deficiency anemia, thalassemia, or anemia of chronic disease. Even before the examiner becomes happy, you can see that the student himself becoming happy. Oh, I'm telling so many things. That's a pretty different life compared to what they ask in entrances. And you see in the entrance, for example, they'll ask in a patient with paroxysmal nocturnal hemoglobinuria, what is the defect? Is it CD55? Is it CD59? Is it a GPI anchor defect? So they go into a lot of specifics, and to be able to answer those kind of questions, a lot of conceptual build-up, a lot of knowledge should definitely be there. And this is one of the problems we see, those, or at least those students who are joining our institute, they don't do much preparation in the UG. They have not read standard books in the undergraduate period. The internship was not utilized in learning. But in the post MBBS phase, when they join our institute in the month of April, they feel that by October we can somehow do some magic and transform them into amazing students, and to be able to compete with some of the best students in the country. That task we've been doing for some years, but then it's not that easy. I really think that people should start preparing in the undergraduate period. I think the best time to prepare, I would say, is the second year. That's the time when you need to really start considering about entrance exams, because the kind of competition that is there, you need to get the numbers straight. This year, 1.48 lakhs around people have written the exam, and we all know that the first 10,000 ranks are going to get something good. Between 10 and 20,000 ranks are going to be on the borderline, and beyond 20,000 ranks, a significant number of those people may not be looking at something good. And most people that I've come across nearly not targeting seats like anatomy or biochemistry. I'm not saying that those subjects are bad. All subjects are good. But generally, those are not the desired subjects for many students who are aspiring to do something clinical. So keep all these things in mind, and realize that this is not going to be easy. Also realize that without preparing for PG entrance exam and without getting into PG, the life and the struggle that is going to be there for the next 30-40 years in your professional career is going to be a very prolonged one. So obviously the reality is that this is an exam that you can't avoid. it is an exam which you are going to study. There are some amongst you who are going to be the first benchers. There are some amongst you who are going to be like in the rounds, in the wards. We see that there are some students always who are a little hyper enthusiastic and they are right in the front and they are maybe the studying type. There are those who are in the mid, and then there are those who are hiding behind others. And it doesn't matter in which category you belong, you will study when it comes to PG entrance exam. The question is, when do you want to start? Would you like to increase your difficulties by starting after you finish your MBBS course? Or would you like to start early? That's a question that you need to ask yourself. When it comes to entrance preparation, there are a lot of doubts in the students' mind. One is, what books do I use? How do I start? What's the correct technique? Is there anything that I can do in my UG period? Can I do something at home before I join coaching classes itself? Can I do something at home itself? All these are questions that I want to throw some light on before we proceed. As we go along, I'll tell you more about all these things. So when it comes to NEET-PG, one of the things that happened was that for the last 2 decades, and I've been teaching from almost 2000 December, so it's been almost 20 years now taking classes for students. But what changed last 5-6 years was in the 2015 we came up with something called Vision 2015 by MCI, and they proposed that we should have a combined exam known as the NEET exam. And this NEET exam, the idea was that it will remove all the malpractices. It will ensure a uniform exam across the country, set a minimum standard, and it will be convenient for candidates because many candidates were giving money exams. To some extent, this was an advantage, and to some extent, this is a disadvantage also. Because imagine if you cannot perform well in those 3 hours on the NEET exam day, then the next exam that is you're looking forward for actually is the, because what exams come in between institute exams like Ames, PGI and all are not having that kind of seats that will give you a good chance of getting it. And when it comes to the DNB exam, the DNB is again not a preferred option. Not saying that it's bad. I'm just saying that it may not be the first preference for most students. So for this reason, I think the disadvantage student had is earlier we used to have a All India exam, and then after that we used to have a state exam, and then other exams by deemed universities that would give many options to students. You don't do well on one day, the other day you're going to do well, you're going to get through somewhere or the other. It's not the case here. NEET is the only exam, and through that private college admissions, whether it is the whatever colleges, you have to take admissions through NEET, except for some of the deemed institutes which conduct their own exams. And in this exception, only Ames comes, PGI, NIMHANS and JIPMER. Barring all these, everything is under the umbrella of NEET. So this then becomes the most important exam, which is going to give you a huge option of seats. And if you get a good rank in this, then definitely you have a wide array of seats, and you can pick up something that you really like. The number of questions and things we'll discuss in more detail later. I want to focus more on NEET actually. NEET is a single response MCQ. What do you mean by single response is you have a question, you have 4 choices, and one of those choices is the correct answer. That's the single best. This in comparison with what we discussed later, PGI. PGI is an exam in which you have, and any of those choices can be correct. Means it's multiple choices correct. That's not the case here. Here it's a single best response. NEET contains a mixed base of questions. Some of these are concept based questions and some of these are factual questions. It also has images, and recently we saw that video clips are being included, and those video clips, they are showing video clip of a seizure, they are showing video clips of different things and asking you, what do you see in this, what's your interpretation of this. So by the time, I think many of you who are sitting in this hall here, some of you are undergraduates, by the time you give the exam, we are expecting that even audio clips might be added. They might play an audio clip and ask, what murmur is this? Is it aortic stenosis? Is it aortic regurgitation? So over a period of time, we're noticing that the testing methods have become more refined now, and they are asking in more higher level questions, and they are asking video clips, they are showing images, they are playing audio clips, and they're going to ask you what's the diagnosis. In general, one thing you'll notice is they are testing everything. Basically, all things from the first year until the final year, almost everything is getting tested over here. So NEET is an exam that is a single response MCQ based exam, and it's got a mixture of concept based questions and factual questions. Largely all MCQs you can divide into two. Either they are factual questions. One example is, If they ask you tumbling motility seen in what bacteria, that's a memory-based question. That is just a simple fact that you need to know. Like if they ask you Bigelow's ligament is it seen in hip joint, knee joint, ankle joint? That's a memory-based question. That's a factual question. What we mean by conceptual questions are that they give you a list of data and you need to have an idea. They'll give you a lot of history and they'll ask you, based on this history, what's the likely diagnosis? To be able to answer that question, you need to understand what's the differential diagnosis for somebody presenting with these complaints, and based on the age, based on the presenting complaint, what disease is most likely. Some point in the MCQ will tell you that this is the disease that is most favorable among the choices. That's generally a concept-based question. So broadly, you can see two kinds of questions. One is factual-based questions, one is concept-based questions. And this differentiation is very important because once you start understanding how to attempt questions, there are techniques that we evolve in answering MCQs. And all those techniques are built on this idea. Do you think it's a factual question or do you think it's a concept-based question? I was telling you images are coming, video clips are there, and audio clips also are coming now in our exam. A few words about the Ames exam. Now, Ames is definitely the premier institute that is there in our country, and it is definitely the best institute that we have, Delhi Ames particularly. There are 4 or 5 peripheral Ames, but none of them have reached the standard of Delhi. And the peripheral Ames are on par with some of the government colleges that are there in the states. But the Delhi Ames is definitely in a level of its own, and it is definitely one of the sought after institutes to do post graduation. If you're able to get in this institute, then the level of knowledge you'll be surrounded by some of the cream of medicos in the country, and the investigation, there's no limitation. The approach to patient is going to be very different from what we do in our typical government colleges in the states. So you will end up definitely far better, and this is the reason why people, because the level of reference totally changes. You're now compared with some of the top people in the country. So this is one of the reasons why people are focusing on Ames. Now, one of the things that we've noticed is some students in our states have this feeling that we are not from colleges like Maulana Azad or from Bangalore Medical College or Kim Subli or something. It doesn't matter which college you're from, because when it comes to entrance preparation, the entrance preparation is very different from what we do for UG. And entrance is a totally different preparation which you need to do. And for that, it doesn't matter which college you're from. Everybody has to study on their own, and everybody has to prepare right from scratch. So I was telling you, as far as Ames is concerned, if you want to get into this institute, then certain areas that we need to focus on. And one of those things is you need to focus on clinical scenarios. That means concept-based questions become more relevant. And you will see that the recent updates are important, and images are obviously extremely important. Okay, so you can see clinical scenarios important, conceptual questions are more likely to come in Ames, the recent updates become more important, and then images are extremely important. So all new drugs that are there that have been approved by FDA about 1 or 2 years back, those also become important for MCQs. So one more thing I'd like to add is one of the difference that we have between the Ames and the NEET exam is that if you look at the Ames exam, the number of people who are setting the questions are limited. There are only few people in each department whom we know are making questions. So that's not the case for NEET. NEET, hundreds of people are sending the questions, and the computer is randomly selecting the questions. How this helps us in preparation is, if you're going for the Ames exam, having the idea that only few people are setting the paper, what this info gives to us is that generally, if a person is working on some area, like I'm a medicine person, but I'm interested in rheumatology and I'm working in rheumatology, then I tend to make more questions in rheumatology, and I tend to skip questions in the area that I'm not interested in or I don't want to work in. So if some consultant or professor in Ames is making questions, what he's working on, what he's interested in, what his students are doing thesis on, those are the topics he'll be more interested in asking again and again. What area he's not interested in, what he doesn't work on, he doesn't ask questions in that zone. So one of the ways to prepare for the Ames exam is to look at the previous year papers, because the previous year papers gives an insight about what the consultants are working on, what they like, what topics they're interested in. Once you know those topics, it's sensible to read more about those topics and prepare extensively, and that will help you to crack those exams. Medicine, imagine reading the whole thing rather than that, just reading the focused area. the area in which Ames is working on, area in which those people are interested in, that is better. So one of the important preparations we need to do for the Ames exam is read the previous year papers, because that gives an insight about what they are working on, what they're interested in. What they are not interested in, those topics generally will not be asked. So depth preparation becomes more important. Whatever topic, read more in detail about it. Rather than reading more topics, those selected topics become more important. So last 5-year Ames papers become very important for preparation for Ames. One of the tricky things that we saw was in the 2000s, when I was taking classes in many places in India. We used to notice that in Kerala had become a major zone where people used to come to Ames and used to bag most of the ranks. And at that time, people were wondering what's so great about the Keralites. I mean, are they more intelligent? What's the reason? How come they are able to get into Ames? Finally, the truth dawned, and what we saw was many people who are cracking Ames. When we spoke to them, it came out that many of them had started to write Ames exam in the UG period itself. Those days, one of the problems we used to have was these kind of online platforms were not there. So questions were, genuine questions which were asked in the exam were not present with students. We used to rely on books, but many of those had recall errors, and the actual question that came in the exam was not there at all. So these Keralites, they used to write the exam from their second year, pre-final, final, and by giving these exams, obviously they're not eligible. By giving the exams, they used to come back, they used to remember the questions, they used to recall the questions. They actually have given the questions themselves, the exam themselves. They have remembered the question, they come back, they read about it, and then by the time they go for the exam, actual exam, post-MBBS, they already have written so many Ames themselves. They have an idea what the questions are. They have the genuine questions because they would have written it, and they would have done a lot of research on it. By the time the Ames gets over, they are ready for it, they go for it, they crack the exam. This is one of the reasons why I would not recommend people to do that now, because now we have Tata Consultancy who's been given the task of the security purpose for Ames and NEET exam. And they are taking fingerprints, they are taking photographs, they are establishing a very secure base. It's all online. And if you cheat the system, if you write with some other name or something as an undergraduate, that will be picked up now, and that is not allowed. Anyway, the point that I want to highlight here is that those who start preparing in the UG definitely have an advantage, and that's one of the reasons why we saw those students used to crack the Ames exam. So yes, those undergraduates who are looking for cracking the Ames exam need to buy the Ames previous year papers, start looking at the questions, and start working on those topics. When it comes to PGI also, select number of consultants are making questions. This is different from NEET. NEET, hundreds of consultants sending questions. National board is picking up questions. The computer randomly selects questions. So the previous year papers value may not be that much when it comes to NEET exam compared to what we see in Ames and PGI. Ames, PGI, both. Ames, PGI, JIPR, all three. The previous year papers are very, very important. If you're going for these exams, make sure you do read the previous year papers. And books are available on these, and you will be able to find the questions for these. Now comes the important aspect of NEET. In the year 2012-13, when NEET started, it was a multiple paper pattern in which we used to have something called psychometric analysis. We had 10 sessions, morning session, evening session. It used to be conducted over 10 days, rather 8 to 10 days. So there were more than 10 sessions. I think 18 to 20 sessions used to be conducted. And National Board had to generate around 4,000 plus questions every year by the end of the year to do the NEET exam. If somebody is given the task of generating 4,000 questions, then obviously making intelligent, sensible questions is going to be a difficult task. One of the things we saw between 2013 and 2018, almost the kind of quality of questions that were there were very bad. Many of them were factual questions, many of them were most common questions, and many of the questions were things that were difficult to understand why they were asking. Like they asked, what's the velocity? So I think those things were there at the time when multiple papers were in session. It was, because one of the limitations NEET had at that time, they made it an online exam. But to conduct an online exam at one time across all the cities, the infrastructure at that time, they were not confident of it. And any computer crashes, and any students, 10 students somewhere in the country are not able to give the exam, then we have to cancel the entire country's exam and redo it. that's the reason why they came up with multiple sessions, and this is what we call psychometric analysis. So 20 days the exam is going, 10 days the exam is going. First day some students have a problem, they can't give the exam, their computer crashed, whatever. You ask them to write in the next session. Obviously the set of questions from first session, second session are different. To get a single ranking, a linear ranking among people who are giving different papers, they used a software called psychometric analysis, which is what we use in USMLE exams. So that was the pattern that was there. Why I'm telling you this is that looking at questions from NEET last 4 or 5 years, there are in that question bank certain questions which will never be repeated in the exam. This is because many of those are very factual, many of those have very low value. Now, how do you know what question is really good and what question is not good? We have certain software, and I want to draw your attention to one particular software that is known as Descriptive Index. What you mean by Descriptive Index is that we have a question, and in that we have a software, an app that can find for us how good a question is. Generally, whatever question is there, compared to all the other people who have attempted that question compared to all the entire paper, for example, let's say about 1,000 people, just an example, 1,000 people attempted the paper, and that particular question in point we are talking about that. If let's say 500 people attempted, these are toppers, 5,000 people give the exam, 500 we consider high scorers, 500 we consider as low scorers. Now the first 500 people, first 500 toppers that are there, what percentage have got that question correct? What fraction of the bad rankers got the question correct? If the question has been answered correctly by a fraction of toppers and a fraction of bad rankers, that question is not that good. It means that it's not discriminating between those who have read and those who have not read. Supposing a question is answered consistently correct by toppers and consistently wrong by bad rankers, that question has the power to differentiate between those who have read and those who have not read. So now we have softwares and formulas and statistical analysis to tell what questions are good, what questions are useless. If a question is answered by guess, if a question is not differentiating between those who have read and those who have not read, do you think that question will repeat in the future exams? Definitely not. So my point of instruction here is that many of you are going to look at the NEET papers, past papers, to prepare for your future exam. It's important to understand, if you think it's a very factual question that looks kind of stupid, like they asked, what's the percentage of road traffic accident between 2 and 3-year-old children? Now those questions, it doesn't matter what the answering pattern was in the exam. You know that question is not a discriminative value question. It will not differentiate between those who have read and those who have not read. That question will never be repeated. So you should know in the previous year papers what questions to really break your head about and what question you need to be serious about. Do some questions from the last NEET papers, will they repeat in the future exams? Yes, they can. What kind of questions will repeat? Those questions that are sensible, those questions that are going to differentiate between those who have read and not read, those are the questions that are likely to repeat. Any question that looks logical to you, read about it. Any question that looks too factual, some nonsensical question, don't worry about it. It may not repeat in the future exam. So I hope at this point I'm able to give you this idea that for Ames exam, previous year papers are very important. For PGI, NIMHANS, JIPMER, previous year papers are important. Problem with NIMHANS is we don't have a collection of previous year papers. Rest of the exams we have. When it comes to the NEET exam, the previous year papers may or may not be important. Some questions in that are important, some questions are not that important. So keep all these things in mind when you are preparing for these exams. I was telling you about the PGI. So for PGI Chandigarh also, the previous year papers are very important, but you should understand that each question has got 5 options. Multiple options can be correct, and negative marking can be a little high in the PGI paper. So in general, what we say is about 50% choices generally need to be attempted, or more than that should be attempted rather. So if there are 250 questions and each question has got 5 options, that gives you totally 1250 options that you need to decide on. And roughly you will see that about 700 plus choices might be correct answers. Why I'm saying this is people under attempt and come. If you don't attempt enough questions in the exam, if you don't shade enough questions, then the chances of you getting a good rank is going to be lesser. When it comes to NIMHANS exam, then NIMHANS is definitely the best neuro center that we have, not just in India, but the entire Asia. The amount of research that is happening in NIMHANS, every kind of case that you look at from neuro aspect is there in NIMHANS. The amount of articles that are published from here, it's really amazing. So neurology in NIMHANS is definitely very sought after, not just neurology, psychiatry and neurosurgery also. And on NIMHANS has got a pattern of asking questions in which recently they changed the pattern. One of the things that they have done now is you have 100 questions paper in which 70 questions are common. 70 questions come from all subjects. So all subjects means what? It comes from NAT, Biochem, Patho, Micropharmac, Physio, everything. All your what is being checked in NEET, basically 70 questions are all subjects. 30 questions are specialty questions. Now, if you're giving DM Neuro entrance, that is a 5-year course, 5.5-year course, then you're going to have 100 questions correct. But the 70 questions from all subjects, 30 questions are only coming from Neuro. Same way, if you want to give neurosurgery, 70 questions are from all subjects, but 30 questions are coming from neurosurgery part. And in neurosurgery part, basically, what do they ask? They're asking questions from trauma and tumors of the brain. Okay, the neurogenic tumors and trauma, head trauma particularly, becomes very important. Resuscitation in trauma becomes very important. So that is for neurosurgery and neurology. For MD psychiatry, which is a 3-year course, if you want to give in NIMHANS, then 70 questions again are common. 30 questions will be purely from psychiatry. So I hope you understood this idea that preparing only for psychiatry or neurology or neurosurgery may not get you in this exam. You need to be prepared for the remaining 70 questions as well. So 70 questions are coming from all subjects. This explains why that most people who give the NEET exam and who have done well in NEET and who are continuing their preparation, because what happens after NEET, people just lose contact with their studies. There are some, however, that after the NEET exam also, they continue to study. And when the results come or whatever happens, they don't break from their study routine. As they continue to study, they are well prepared. And by the time around March, you see the exam this time is going to be 2 times a year. So around March, when the exam is going to happen, then most people who have already done well in NEET are already capable. They have done well. They're going to do well in the remaining 70 marks. Now they just have to focus on psychiatry, neurology and neurosurgery part. And if they are able to read that, then they do well in NIMHANS. So in my teaching career, I've noticed that most people who are cracking NIMHANS again are those who start early. And it's not a must, but definitely those who start early, whoever it is, cannot compete with somebody who started very early. And I still remember taking classes in a place called Aurangabad about many years back. And one student, undergraduate, walking out of the class and asking me, "Sir, I want to prepare for NIMHANS. That's my dream." And I was surprised कि undergraduate and he's got NIMHANS as an aspiration. And I was whatever I could tell you now, I've just guided him कि this is the area, this is how you need to prepare for NIMHANS. And then he did get through NIMHANS. He got into DM Neurology. He finished DM Neuro, and he's obviously now a well-recognized consultant in Bangalore, working in Narayan Hrudayalaya. So what I want to tell you is that most people who are preparing for NIMHANS, they start early. And they focus on all neuro part, like neuropatho, neuropharmac, neurophysio, neuroradiology. So whatever subject you read, the neuro part of it should be read in more detail. Especially neuroanatomy becomes very important. So neuroanatomy has to be read in a lot of detail from any book of your choice. But after that, Robbins, you read neuro part, pharmac, you read neuro drugs, micro, you read neuro part. So wherever neuro part is there, that should be stressed, and that should again start from the UG period itself. And if you're able to do that, then NIMHANS is something that is achievable. And if you are able to get in this institute, then definitely you'll notice that it's an amazing place to work. The work ethics are very good, the teaching is very good, and the quality of cases that you see are really amazing. So this pattern that used to be the single paper has changed now. As far as the DNB exam, the November DNB has been removed, and now only DNB is conducted in the month of June, July. So only one DNB exam is there now. And this allows you to take admissions in private hospitals, which are approved by National Board. So it's just like NEET. The exam is contains images. It's got a central counseling, and DNB earlier used to be considered kind of inferior to MDMS. That's not the case now. DNB is on par with most of the MDMS courses now. And anyway, those who are doing MD medicine, for example, or MS surgery, if you can do DNB, ultimately you need to do specialization. That is, you're going to do MCH or you're going to do DM. And once you do DM, then nobody cares about where you did your PG and what, which college you did your UG. Those things don't matter. As far as the psychometric analysis, I don't want to go through this now because those patterns have changed now. So I'm just skipping through some of these things that used to be important earlier. I was already giving you the idea that there are two kind of questions. There are concept-based questions and factual questions. And you need to make a decision whether the questions are conceptual or factual. Why? I'll explain. The technique of answering is different for both. That's why you need to understand whether it's factual question or conceptual. A factual question, I already told you, a single liner is memory-based question. A conceptual question has got clinical scenarios, multiple sentences, lot of data is given, and using the data you have to come to a conclusion using a judgment. What's the likely diagnosis? What's the first investigation? What's the investigation of choice? What's the best investigation? What's the initial treatment? Why are we giving? There's a logic behind certain initial treatment. If there's a surgery, there's a principle behind the surgery that we're doing, and what's the principle behind it? Those are all conceptual questions. So how to approach a question? For example, if you see this question, now what you're seeing in this is definitely you see a lot of clinical findings. Even you're seeing T4 levels, T3 levels are elevated. So you can see the description of the question. Basically, this is a question. This is a patient who's got thyrotoxicosis. I'll give you some time for you to go through this question first. Okay, so if you've been able to go through this question, what you're going to see is that this is a description of a patient who's got thyrotoxicosis features. You can see the fine tremors that happen in this patient. This is what we call exaggerated postural tremors. And this tremors because of the beta-2 receptors in the forearm muscles. It happens. These are fine tremors. Patients are going to have heat intolerance and they have bulging eyes. All features in favor of thyrotoxicosis. Further features they're giving, T4 levels are elevated. Okay, you can see the T4 levels are elevated, the T3 levels are elevated, and they have given that the TSH is undetectable, means it is decreased. One major clue they're giving is the radioactive iodine uptake test was found to be increased. And they're giving you a set of choices, and if you see these choices, you'll notice that each of these choices actually is capable of increasing thyroxine production, and thyrotoxicosis can occur in all of them actually. Hashimoto's thyroiditis is a thyroid inflammation. Inflamed thyroid will leak thyroxine out in the initial phases, and once inflammation occurs, the leakage of thyroxine can come with toxic manifestation like this patient. Choriocarcinoma is a cancer that is known to come with thyrotoxicosis manifestation. Struma ovari is an ectopic thyroid tissue present in the ovary, and that ectopic thyroid tissue in the ovary also can produce thyroxine. Thyrotoxicosis factitia is anything factitia means person is creating it. This person is taking thyroxine tablets, for example. That's how the thyrotoxicosis occurred. That's called thyrotoxicosis factitia. My point is the initial description of the question, the presence of fine tremor, heat intolerance, the fact that T4 is high, T3 is high, and TSH is low. That finding of basically a patient having thyrotoxicosis can be there in all of them. So what is it that is differentiating among them is the radioactive iodine uptake. If you know the concept behind it, then it's very easy to answer the question. That's why I was telling you this is a conceptual question. Now, here comes the important tip of how to approach these kind of questions. If you think it's a factual question, then use your memory to select out the best answer. That will be the correct option. So all factual questions, the technique of answering, use your memory, select the best option. Whatever you can remember, that is the one that you're going to choose, that's the answer. In all conceptual questions, don't go for what the correct answer is, but eliminate the remaining three options. Let me repeat this. Memory-based questions, select the best answer. Conceptual question, eliminate the remaining three options. If you're able to better your technique of answering in the exam, you'll notice that definitely you're going to have an improvement. We saw this year and last year also that between the first rank and second rank, there's a huge marks gap. Second rank and third rank, there's a big gap in the marks. Same thing, and you will notice that the first 1,000 ranks almost are spread out. But between the 1,000th rank and around 4,000 rank, this is a peak we say, and multiple peaks we saw in the results this year also. And people are clubbed together. Many people in the country think alike. They choose the same options. They make the same mistakes. The percentage is almost similar, and the gap is just 1 MCQ sometimes. And you get a few questions correct. You're in this side, you're picking up some top colleges. If you're this side, you're picking up something that is average. So if you are in such a tight scenario and you are in a group, in a peak, and you want to come out of the peak towards the tail and you want to do better, then one of the ways is not just your knowledge, it's your answering technique. If your answering technique is better, definitely on the day of the exam, you'll have the confidence of doing well. So one technique that you need to follow: all memory-based questions, choose the correct option. All conceptual questions, eliminate the remaining 3 options. If you follow this technique, you'll see the probability of getting your questions correct is going to be much more higher. So what is this concept of the radioactive iodine uptake? Is obviously for formation of thyroxine, one of the things that is required is iodine. If iodine is taken up, then only thyroxine formation happens by the thyroid. So one of the raw materials that is required to form thyroxine is iodine. The iodine pumps are triggered by the TSH receptor. This is the switch of the factory, and this controls the iodide pumps, the sodium iodide pumps. So if this switch is on by TSH or by anything, then the iodine gets pumped in, and it's clubbed with something called tyrosine. The tyrosine plus iodine actually results in formation of T4 and T3. That's the logic. So basically, when new thyroxine is formed, what is required in the raw material? Iodine is required, tyrosine is required. Mainly we focus on iodine here. If iodine is taken up, then only thyroxine is formed. Another important concept to understand is, if you should have an idea of how we test radioactive iodine uptake, how do we really go ahead and check whether iodine is taken up by thyroid or not? What we do in these patients is we give them oral radio labeled iodine. So how do we give it? Not injection, we give it orally. You give it something orally, it's going to go down the esophagus, it's in the stomach, it's there in the abdomen, it's going to get absorbed in the intestine, and is there in the blood. But what we do, we put a gamma camera in front of the neck and see in the thyroid how much iodine is getting pumped inside. So that is how we check for radioactive iodine uptake. Keep a camera, gamma camera, look at the thyroid and see how much iodine is getting pumped inside the thyroid. So if that is the method of how we're doing it, look at the various choices that are there. Look at choice 1, that is a condition in which the thyroid is inflamed. If the thyroid is inflamed, an inflamed thyroid that is leaking thyroxine, patient can be toxic, agreed. But an inflamed thyroid is damaged and iodine pumping will not occur. One more reason why iodine pumping will not occur is whenever thyroxine is high, what do you think will happen to the pituitary, which is thyroid is under feedback from pituitary. What happens to pituitary? The TSH is suppressed. Problem is in thyroid, pituitary is normal, by feedback TSH gets suppressed. Without the factory switch on, TSH receptor on, iodine pumping cannot occur. So it's a simple concept to understand that in a patient with thyroiditis, especially in this kind of scenario, what is happening to the radioactive iodine uptake? So Hashimoto's thyroiditis, definitely iodine uptake will be decreased. Why is it decreased again? It's an inflamed, damaged thyroid. It will not pump iodine in, and iodine uptake will actually decrease.
As we know that we all have come here to attend orientation program for PG NEET, and we all knew that we are also going to honor Mr. Ashraf Kesrani, Dr. Ashraf Kesrani, and who has topped to the nation in the PG NEET 2018. And let me give you a brief introduction of him before you, and further we shall continue the program. Dr. Ashraf Kesrani, born and brought up in Baroda, Gujarat, in a typical middle-class family, having 2 brothers and 1 sister. His father hailing from Lambadia village, now working under his uncle's private business of weighing scales in Baroda, and his mother from Idar, a village of Gujarat, is housewife with a good religious background. He has completed whole of his schooling from nursery to higher secondary from Vidyut Board, Vidyalaya English Medium in Baroda, Gujarat. With merit rank of 14th in Gujarat CET for admission in MBBS, he has got selected and admitted in Government Medical College, Baroda in 2013. During his medical studies, he secured several awards, such as he got first rank in college in first year and final year in MBBS. He bagged the 29th IAP Pediatric Quiz West Zone in 2016 and reached till national level. He was the runner-up in IAP PSM Diabetes Quiz all Gujarat level. Recently, he has achieved a remarkable milestone by securing all India rank 1 NEET-PG exam, which was conducted on 6th of January 2019. And with this introduction of him, I would like to request Dr. Abdul Khadir sir to escort all the guests on the dais, so we can have his felicitation on the dais. Mr. Dr. Ashraf Kesrani, along with his father, please come on the dais.
अस्सलामु अलैकुम। मैं डॉक्टर अशरफ केसरानी और उनके वालिद मोहतरम जो बड़ौदा से यहाँ पे आए हैं, ये हमारे लिए खुशी की बात है कि एक ऑल इंडिया टॉपर को हमको यहाँ पर ऑनर करने का, वेलकम करने का, और उनके ज़रिए यहाँ के शाहीन के स्टूडेंट्स जो तकरीबन अभी 1100-1200 स्टूडेंट MBBS में पढ़ रहे हैं, उन सब को इनकरेज करने का मौका मिला है बीदर में। और बीदर के अलावा तकरीबन 20-22 सेंटर्स में ऑनलाइन हमारे स्टूडेंट्स ये प्रोग्राम देख रहे हैं। इसके अलावा कि केबियन मेडिकल कॉलेज और गुलबर्गा अलमीन मेडिकल कॉलेज में भी ये प्रोग्राम लाइव यहाँ से बच्चों को दिखाया जा रहा है। मैं इन दोनों का इस्तकबाल करता हूँ और शाहीन के तरफ से, शाहीन के स्टूडेंट्स, टीचर्स, मैनेजमेंट, बहल शाहीन फैमिली के तरफ से इनका सबसे पहले ऑनर किया जाएगा। इसके बाद में बीदर के मुख्तलिफ NGOs यहाँ पर मौजूद हैं, वो भी जो है यहाँ पर मौजूद हैं अपने हाथों से, वो भी इनका इस्तकबाल करेंगे, ऑनर करेंगे।
Not only Shaheen, there are many people, many institutions from Bidar who are going to honor Mr. Ashraf Kesrani. I would like to call MD Azhar Pasha sir from Global Education Center to come on the dais. And I would like to also invite Dr. C. Anand Rao from Indian Medical Association to honor on the stage. Followed by we have Maulana Sayyid Abdul Wahid Khasmi Sahab from the organization called Rabta-e-Millat. Please come on the stage. And we have one more guest who is going to honor Mr. Kesrani, is Shambuling Wadodi. Please come on the stage, sir. And also we have Channama, sorry. And we also have Channama Vallapure to honor Mr. Ashraf Kesrani. Please come on the stage. And we also have MD Riazuddin Qureshi. Please come on the stage, sir. And Hanmatappa sir, I welcome you on the stage. Basakumar Patil sir, I welcome you on the stage. And we also have Akhtar Ahmad Khan. Please welcome on the stage. And along with Muhammad Mohsin Qureshi. They are all the people from dignitaries of the Bidar who are going to honor Mr. Ashraf Kesrani here. Please a big round of applause. I request the audience to have a big round of applause over here. Baswaraj Patil sir, please. And we also have another guest, Ansar Beg sir, please come on the stage to honor Dr. Ashraf Kesrani. And Dr. Dr. C. Anand Rao sir is also willing to felicitate Dr. Abdul Khadir sir. He is from IMA Bidar. Yes, Dr. C. Anand sir is going to felicitate Dr. Abdul Khadir sir. Big round of applause, please.
जो बात बोल को करना
ऐसा है क्या? ओके. Basu Kumar Patil sir is going to honor Dr. Ashraf Kesrani sir and his father.
Ashraf
Kesrani.
शुक्रिया. मैं इस दुआ के साथ अशरफ केसरानी साहब की गुलपुश कर रहा हूँ कि बीदर से भी हमारे नौजवानों में, हमारे स्टूडेंट में इस किस्म के स्टूडेंट हो. बिलखुसूस शाहीन दराजा से हमारी कवी इम्कानात हैं, उम्मीद है कि वो भी इस किस्म के स्टूडेंट हमारे शाहीन से भी हो. इतना कहते हुए मैं उर्दू टीचर्स की जानिब से अशरफ साहब की गुलपुश करता हूँ.
Dr. Ashraf Kesrani, we are much privileged to have you here among us, and it's a source of inspiration for all the students of Bidar and Shaheen in particular. Thanks a lot. I personally said render a great thanks to all the dignitaries. Thank you, sir. Please. Now, as everybody is waiting to listen to the priceless words of Mr. Dr. Ashraf Kesrani, on behalf of everybody, I would like to request Dr. Ashraf Kesrani to address us here on this occasion.
गुजरात में फूल का रिवाज नहीं है, लेकिन यहाँ पे ट्रेंड है इसका. खुशी का इजहार के तौर पर ये फूल पिनाए गए हैं. अशरफ केसरानी बहुत ही सादगी के साथ रहते हैं और बहुत ही पाबंद शख्सियत हैं. वो स्टडीज़ के दौरान भी अपने फ़राइज़ से भूले नहीं, बल्कि वक्तन फ़ौक्तन जमात में 3 दिन 10 दिन भी लगाया करते थे. बहरहाल मैं ख्वाहिश करूँगा अशरफ केसरानी से कि वो यहाँ पर एड्रेस करें और वो अपनी तैयारी किस तरह से किए हैं वो मेडिकोस यहाँ पे मेडिकल के तलबा जो हैं उनके सामने पेश करें.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon to one and all present here. सबसे पहले तो मैं अपने अल्लाह का शुक्रिया अदा करता हूँ जिसने मुझे इस मुकाम तक पहुँचाया और लोगों की नज़रों में इज़्ज़त दी. Whatever I achieved till now is because of Allah's grace and obviously because of the persistent hard work. I would also like to thank the Shaheen Group of Institution for calling me here and to give me the opportunity to address the students of MBBS who are basically going to give their NEET exams in their future. Not taking too much time, basically, first of all, I would like to share what I did during my UG period and what I did during my internship period, which basically gave me the good rank in NEET-PG 2019. So, if it's in single line, I would like to say what gave me this first rank in my first attempt. It was the persistent and consistent hard work of whole 5.5 years period, including my UG and internship period. So basically I want to say that there is no alternative to hard work. There are no shortcuts in life to get success, to get what you are dreaming about. So when I am saying dreaming about, basically it's very important for each and everybody here, may it be a medical student or any other student, to dream as high as possible. Basically only when you dream as high as possible, when your goals are set as high as possible, then only you are going to work after it. If you set your goal low, if you set your dreams low, then basically you are demotivating yourself. You are not allowing your basically the capability to come out. So first it's very important to see dreams. I'm not talking of the dreams at night. I'm talking of the dreams that we see during day about our future. So with respect to NEET examination, NEET-PG or any other entrance examination after MBBS, the first thing to basically set in our mind is what rank we want to achieve. So as I said earlier, we should dream as high as possible. So the highest dream would be to get the first rank, to get the single digit rank. I know practically it's not possible for each and everyone to get first rank, but it's just after we give exams. Before exam, anybody from us, anybody from you can get that first rank, can get single digit, and can get top 100, top 1000, which is considered very good rank. So never demotivate yourself. So it's self-motivation and self-confidence is something which is very important, and it will take you to the heights of success. So I would talk about my preparation in basically 3 phases, or how a student should approach for the examination in 3 phases. First is the preparation before the internship, preparation during internship, when you are going to give your first trial of NEET, and preparation after NEET after the internship. So after the internship, it's basically for those who are having very hectic internship. Very frankly speaking, my internship was not very hectic. Like I was able to manage my studies, my preparation for NEET very well during my internship only. But said that, it was basically my 4.5 year UG preparation, which basically played more important role, major role in getting good rank in first attempt. So basically during a UG period, the most important and the most basic thing is to clear the concepts and basics about each and every 19 subjects. So what mistake that we do? First is we are not oriented to this entrance examination when we are in first, second, third or final year. When we come in internship, then we'll know like there is some exam which we are supposed to give after our internship, after our MBBS, so as to get the admission in MD, MS or DNB. When I was in first year, I didn't have any idea about basically what such entrance exam is, does it exist or not. At that time, it was not at all compulsory. Basically, there were state exams. NEET exam was not compulsory. But then when I came in second year, I had some orientation, I had some idea that there is some exam like NEET, which I have to give after my NEET-PG, after my MBBS. So basically, my preparation per se started in second year when I'm speaking about NEET-PG. So the most important thing is to start as early as possible. When I say as early as possible, I don't say first year. Why not first year? Because first year is a phase when you have basically got a sudden transition from the school life to the college life. So it's okay if you are not much like focusing on the NEET-PG, which is going to come after your 5 to 6 years. First year is already too hectic. For some it's difficult to understand the medical terms, but after 1 year you are basically used to those terms. So my preparation started in second year. The most important thing that I was basically different from some of other students. What some of my friends were doing, like they were just focusing on their college examination or the university examination that is going to held at the end of the year. So they used to read very selective topics from each subject, and no doubt they were able to get good marks in their UG examination, university examination, no doubt. But that doesn't help for long. That doesn't help for your entrance exam preparation. Having said that, it's not like you have to read something different, you have to read something new during from your second year. It's just like you have to change the method, change the approach of studies. Now what I did was, basically first and foremost, most important thing is to read good standard textbooks during your UG period. Not just blindly following your seniors. What they blindly advise you, it's not always like that is the best approach for you also. You need to work out yourself. Like for example, for each and every subject, you will be having multiple textbooks available. For each and every subject, you would be having multiple review books available. I would say later on what basically a review book is. So, but then it's important to choose one for each subject. That you would basically know by your seniors, but furthermore you should like individually see each and every book, just go through the book. I'm not telling to read those all books. Then select one which will suit you, which basically you are comfortable with. Maybe like everybody is not reading that book, it's okay. For example, during my second year for microbiology, like most of them, like all of them were reading one book, that is Anand Narayan, which most of the students read. But like I was not very comfortable with that book. No doubt the book is wonderful, the book is great, but like I was not comfortable with that book. So I was always trying to find alternatives, and finally I got the alternative after my mid of second year, and I read the Apurva Shastri's book. Like I was very comfortable with that book, and I always advise each and everybody to read that Apurva Shastri for microbiology. I will like let you know each and like subject wise which book to read later on. So basically what options you all have as of now. At that time I was not having many options, but like as of now there are too many options available for the preparation of NEET right from your UG period, right from the second year. First of all, I would like share the way that I prepared, and then I would also tell some other possible ways of preparation which are available as of now. So basically what my aim was during each year, like in second year, third year or final year, I used to read the standard textbook as all others used to do. But as everybody know that revising whole textbook to get what is important for us from this large textbook, it's sometimes very difficult for us. So I found one alternative way, though most of my colleagues and seniors were not doing that, but then I found that better for me. I went for the review books of each and every subject during my UG period only, right from the second year. Basically what a review book is basically written by a subject expert. It will contain good amount of theory related to each and every topic, especially which are more important for the NEET-PG. Per se, not just NEET-PG, any entrance, not just any entrance examination, but also for your routine second, third or final year studies. They would they would be very helpful for you basically for the revision purpose. So what my aim was to read the standard textbook very properly, thoroughly, and then go through the review books. The advantage of reading the review book for me was basically that contains the whole subject in a very concise form. They don't basically give some unnecessary things. They just focus on the things which are important. And having said that, it's not very small book, and rather it's not also a very long book to read. So it contains enough information which will also be helpful during your routine university examinations, also apart from your NEET preparation. So my idea of review book was just to clear my concepts and clear my base at that time only. It was not for like I wanted to remember the whole book. It was basically for my understanding purpose. I was very comfortable reading those books. I was able to understand in a better way. But that was only after reading the textbooks. So textbooks are definitely going to be the base, and review books are going to be complementary to that. So basically this was my plan during each and every year, during second year, during third year, during final year. I would like share what I did during my internship later on. First I would like discuss about the pre-internship preparation. So first I would like to share the name of the books that I read. And an important thing, like one size doesn't fit for all. As I said, you have many options available as of now for preparation. So it is possible that the way that I prepared, it may not be feasible for all. But then I wanted to share what I did during my pre-internship period, during my UG period. So for the first year subjects, like I would like to mention the name of the book that I read during my UG period. So for first year, for anatomy, most of them read BD Chaurasia. I also went for the same. Like I know like it's too extensive, but as I always say, it's the UG period only when basically you would be able to read whatever you want to read. You cannot just keep the subject, you cannot just keep the important topics and keep it for your preparation before your NEET preparation. That never comes. So it's very important that to read as much as possible during your UG period only. Focus on the subjects that basically you are reading during your individual year of preparation. So for first year anatomy, I read BD Chaurasia. For biochemistry, like I know the Harper is the best one that you could go for, but like the trend, as I was in first year, I was like blindly following my seniors. So I basically read the Satyanarayan biochemistry book. At that time, like I was very comfortable with that book, and I was very okay with that. But if you can go for William Harper, it's your choice. It would be good. But Satyanarayan and Vasudevan both are also equally good for biochemistry. So I won't say that single book is best for you, but like it's always advisable to go for the standard textbook. Then for physiology, I would recommend please don't just blindly follow your seniors, what seniors read. Don't just think the preparation of university exam. Please think long term. Think about the NEET examination. Think about the entrance exam that you are supposed to give, which is compulsory for all. So please do read Ganong book and Gaitan. I'm saying why I'm saying and, like as Ganong like is a very doable, readable book. It is not very extensive. You can read that book easily. Though it's a foreign author book, initially you would find like some difficulty, but once you read it, when you read it once and then when you read it second time, it would be very easy for you to understand those books also. So I would recommend Ganam, and for some topics you can also refer Gaitan, which gives each topic a little bit more in detail. So these trial and error things for the preparation of physiology, I mean for any subject you can do only if you have time, and definitely there is always time during your UG period when I am like basically I am saying for NEET-PG preparation, when at that time you would only be having 8 months, 10 months of preparation time. At that time it won't be possible to read any standard textbook, any textbook, even if you would like to read that. So it's always a better idea, good idea, to go through the books during a UG period only. Then for second year, I'm talking of the textbooks that I read, then I will mention the name of the review books that I read. Then for second year, for pharmacology, I read the Garg and Gupta's, I read the Sharma and Sharma textbook, and as a complement to that, I read some topics from the Katzung. But like I always advise, it's not always advisable for all to like go through 2 to 3 books of each and every subject. Keep one book as your reference book, standard book, read that completely. And if you feel some topics are not given in this book in a better way, you can always like refer to some other book in which the topic would have been given in a better way. But keep always one book for each subject, one standard textbook for each subject, which you will read completely. So for pharmacology, I was comfortable with Katzung. I'm not saying KDT is a bad book. Like it's also a very amazing good book, but I was not like comfortable reading that book, so I went for Sharma and Sharma, and to some extent Katzung. For pathology, please read Robbins' Pathology only. You would think like university exams के अंदर तो बहुत सारे questions like out of the Robbins आते हैं, but then like for your UG preparation, for your exam preparations, it's okay before your exam if you refer to some other book. Some topics won't be like mentioned very well in Robbins, but it's very advisable. It's very advisable that you read Robbins' Pathology. Like why I am saying for second year subjects, because second year subjects are going to be the bulk. They are going to form the base of all other clinical subjects that you are going to read in future. So I always say 4 subjects were extremely high scoring for me, especially with respect to NEET examination: Pharmac, Patho, Micro, and OBGY, Obs and Gynec. All subjects are equally important, but why these 3 subjects, Pharmac, Patho, Micro? The reason is because they have all other subjects always have some link to these subjects. So if you are clear with these 3 basic subjects, which are basically going to form your foundation for a future clinical subjects, if you are very thorough with these subjects, you are basically halfway done for other subjects also. It will be very helpful in your future clinical clinical subject preparation. So for pathology, do read Robbins. For microbiology, as I told you earlier, I read Apurva Shankar Shastri's textbook. For forensic medicine, I read Reddy. But for forensic medicine, I would like advise that during your actual phase of NEET preparation, you are not going to get any time to like give much time for forensic medicine, because like 5-6 questions are asked. So it's very important that you are clear with that subject during a UG period. So I would strongly advise, even though I was not able to do that, I regret, but like I would strongly advise to go through the review book of Sumit Sheth for forensic medicine. It would be really helpful for you. Like it contains too much content which would be unhelpful for your UG examination also for sure. Then for first pre-final year preparation, we have these ENT, ophthalmology and PSM, that is community medicine. For ophthalmology, I went for Khurana's textbook of ophthalmology. Like I know Parsons' textbook of ophthalmology would be a better option. It in a way that it has concepts and understanding well, but I found that book very extensive for ophthalmology, so I preferred Khurana's ophthalmology only. For ENT, Dhingra is the book. Like it is more than enough for us. For a UG, Dhingra's ENT textbook is just more than enough. Then for PSM, the universal book for everybody is like Park, and I know Park is too extensive, a long book, but then like we don't have option, we have to read that book as much as possible. I'm not telling you need to read 100%, but like read it as much as possible. It is always going to be helpful in your future other subjects also. For final year, we have 9 subjects, 4 major and 5 minor subjects. The 4 major subjects like medicine, surgery, pedia and OBGY. So for all these clinical subjects, like what my way of preparation was, we have postings, clinical postings from our second year. We all have such clinical posting from second year. So it's very important that you utilize your time of clinical posting, that basically giving some time every day during your clinical posting, ward postings, to read those subjects. Because medicine surgery cannot be completed in just 1 year. I'm not telling completed, whole subject can never be completed. But even going through the subject, even superficially, it's not possible to go through in just final year. So it's important that you start reading those subjects, at least the clinical aspects and theoretical aspects, which basically you are exposed to during your ward postings and clinical postings. So if you start surgery, medicine, OBGY and pediatrics during your from second and third year, it would be very helpful in your final year preparation. It is definitely going to be helpful. You can utilize that time for starting to basically start reading those subjects. So for surgery, for textbook, I read Love and Bailey. For medicine, like as I had much passion for medicine since my third year, I had started reading medicine from multiple sources, but like it's not advisable for all. You can just select one book, like Harrison is one book, but like I know it's too extensive. For Harrison, I would say it's not necessary to read whole book for us. It's a PG book. You just need to read those common things which basically are asked in NEET, not just NEET, basically which are common. Like even if you are able to read 50% of the book, it would be more than enough. But read those, they call it is like topics which are very important for us. That too is possible only if you have started reading that book during your second or third year. For surgery, Love and Bailey. For pediatrics, OP guy is much more than enough. For pediatrics, OP guy is more than enough. For OBS and gynec. For OBS, I prefer to read, like Datta book is very good, no doubt. But like I prefer to read Williams obstetrics for me. For obstetrics and for gynecology, I read Datta mainly. But like if you are able to read Shaw's gynecology, then it would be better option. But like for OBS and gynec, I would like clarify one thing later on, what I did during my UG preparation. Then for this minor subjects, please don't consider this subject as minor and skip them. Though they are named as minor, they are small subjects, but they do carry a great importance in NEET preparation for a NEET-PG examination also. So what people usually do is they skip this minor subjects. They don't give much importance to these minor subjects. They just go through the important topics for their university examination, and when it comes to preparation for NEET, like it's very new for them. So it's very important for these minor subjects also to take advantage during your clinical postings only. You will like basically for orthopedic, like you have 1 month posting. So devote your some 3-4 hours every day, including those clinical posting time and 1-2 hours extra to read the orthopedic book at that time only. Like that would be basically the first reading for you. And when you will actually read those subjects during your preparation, actual preparation for NEET, it would be like easy for you to recollect those things and to revise those things, these small subjects. So for orthopedic, Maheshwari's textbook is what I read for my exam purpose. But for small subjects, I would also advise that you go through the review books, which are relatively concise, and you can, like, it's doable even during your UG period. So when you revise those subjects during your actual preparation, it would be easy for you. So for orthopedic, as I said, Maheshwari's textbook. For radiology, there is no single good textbook which is like readable by UG students. So like I would say the review book available for that subject would be more than enough, which some like radiology part which is there in all subjects, like from the ENT, Opthel or any other subject, radio part would be there. Do focus on the radiology part of those subjects. Those are going to be the topics which are going to be asked in the exam from the radiology. So for radiology, no need to go for a different textbook, just read the review book during a UG period only. Then for psychiatry, for that also this is the issue, like textbooks are very extensive, but then even for that also I would say review books would be more than enough. Then for skin dermatology, I would say like Nina Khanna is just amazing, wonderful book. You can definitely try to go through this book during your skin dermatology postings when you are having during a UG period. That is the time when you would like to read dermatology. Try to read this small subject, I say, during your clinical postings only. Then one more subject, anesthesia, is left. For that I would advise Ajay Yadav's book, which is like basically he has written the content keeping in mind the UG students as well as for the NEET preparation, for both. It's like the book is enough for that, more than enough I would say. So these were the name of the textbook that I told you. So these are going to be the base of your preparation. So during your UG period, the basic aim should be like clearing and understanding all the concepts and basically to get through the basics of all subjects. It's very important. So if you are able to understand, it's okay. If you are forgetting some topics, that's okay. You would revise those topics in your actual preparation of NEET. You would remember those again. But like understanding the subjects and clearing your concepts is very, very important during from your UG period only. Now, as I said, the way of preparation was like reading the review book along with the textbook. Basically, review book were material for revision also during my uni exams also, and I was able to better clear my concepts from the review books by reading the theory. So, would like to mention the name of the review books also. For first year, as I said, I didn't read any review books because no idea. At that time, I didn't have any idea. But then, I don't think so. First year is already a very hectic year because it's a transition phase, as I said earlier. But then if somebody wants to get the names of the review books, if they want to read the review book, it would be good. So for anatomy, for review books, like for each subject, like there are 2 or 3 authors available. Most of the books would be okay for everybody, but like I would say the name of the book that I prefer to read. For anatomy, like Dr. Raviraj's book Anatomy is, I would say you should go through that book because it's written by the subject expert. He's an professor of anatomy, so better to go for that book. But as I said, like first year में already बहुत hectic होता है. So if you can read, it's good, but if you're not able to read, it's okay. No issues with that. For biochemistry, Rebecca James. So for Rebecca James, I would say the book is very extensive. Like you would be able to better understand the concept from that book. I haven't gone through the book completely. I have read very few topics from it. But then sometimes it happens that in biochemistry, the textbooks sometimes seem to be very complicated for us. So for those topics, you can definitely go through the review books. Review books mein basically the teacher has written in a way that the students are able to understand in a better way with respect to NEET examination. Then for physiology, Somen Manna or Krishna Kumar, both are available for physiology. Krishna Kumar basically clinically oriented physiology. So if you read that book during your first year, many things would go above your head. You won't be able to understand some things. But then both books are equally good. I preferred Somen Manna to read some of the topics. From second year, as I said, I started reading review books very religiously and very thoroughly. It was basically due to these review books, apart from the textbooks, I was able to clear my concepts. So for pharmacology, Garg and Gupta. For pathology, I read Garg and Gupta, but now we have Garg and Gupta, Devesh Mishra and Praveen Kumar. 3 books are available. All are equally good. You can select one which you are comfortable with. As I said you can go through the friends book of your friends or colleagues or seniors and then decide one book. For pathology, all 3 are good. I prefer to read Garg and Gupta at that time. Then for microbiology, Apupa Shastri's, basically he is only having his review book. But if you read his textbook, the content is almost similar. So no need to read the review book of Apupa Shastri during our UG period. No need of that. For forensic medicine, I said earlier, Sumit Shet's review book is what is available, and it's a wonderful book. For third year subjects, for ENT, Sakshi Arora's book is what I read very religiously during my third year only. For Opthel, I would definitely recommend to read the Soch book, that is by Dr. Utsav Bansal. It's amazing book. Like, it's a textbook come review book. It would be very, very helpful for you to understand the ophthalmology in a very easy manner. Then for PSM, Vivek Jain is a famous one for that, and like, it's more than sufficient, more than enough for everybody. For final year subjects, for medicine, like Mudit Khanna is available, but like I was not comfortable with that book, so I read the Dr. Bhatia's. So medicine's review book is available. I read that for medicine. For surgery, Pritesh Singh's book I would recommend. Dr. Pritesh Singh surgery review book. For orthopedic, Apurva Mehra. For obs and gynec, Sakshi Arora. So as I said you, for obs and gynec, I was like very selective in my studies. So I read some topics from the textbooks. I focused completely on the review book during my UG period. The theory that is given in the review book of Sakshi Arora is just amazing. I was like able to cover whole subject in a very short period of time. Then for pediatrics, Taruna Mehra would be enough. It would be more than enough, I would say. For anesthesia, as I said, Ajay Yadav, it's a review book come textbook. For skin, dermatology, Saurabh Jindal's book is available, and it's also a very, very good book. Then for radiology, Rajat Jain sir's radiology review book is available, which I read during my UG period. So now, summating all this in like few sentences, now I would also mention one more thing. Here many students basically are from final year, or many are doing internship, or many are in first year. So as I said you, one size doesn't fit for all. All toppers don't have the same ideas, same ways of getting the good ranks. So this was my way of preparation of going through review books. I didn't join any class during my UG period. That's why basically I chose to prepare by myself with the help of the review books only. So now many would be thinking कि मैंने तो book पढ़ी ही नहीं है third, first में, second year में. So it's okay. As I said you, like the review book I was reading, it was just basically to clear my concepts and making my base strong. So if you have done that with the help of the textbooks, it would be like very much okay, no issues with that. But then, having said that, just going through textbook won't be enough for your NEET preparation, because you need to know something of everything. From textbook, you cannot like revise or read everything in a short period of time. So now, what options are available as of now for you all for preparation? So apart from textbooks, you have basically 3 options that you can go through for your better understanding the subject, or like specifically focusing on the NEET-PG preparation. One would be the review book that I chose. Second is the online video series which is available. Like I would say later on, I joined the Marrow, but it was like plan B, which doesn't include the video part. It includes only question bank and the test series. I would say in detail about that thing in my preparation of internship period. But Marrow also has a plan C, which also contains the video series apart from the question bank and test series. So the Marrow plan C videos that contain, they are subject wise and they are topic wise. So what advantage we have for as compared to textbooks? So basically it is being taught by the teachers, by the subject experts, faculties, teachers through the videos. So like first advantage is we can go through these videos anytime we want. That they are available like for whole period of time. We can read those we can go through the videos at any point of time as per our convenience. And the quality of the videos is definitely, I would say, they are amazing. I'm saying based on the few videos, the free videos that were available, I'm saying on that, based on that. But then I think I suppose that most of the videos would be like enough for you, even for your UG preparation. So it would be like an add-on to your textbook reading. It will like basically help you in clearing the topic in a much better way than you are like after reading the textbook that you are thinking of that topic. So video is one option, online video series is one option, second option, and third option is to join the class. Now everybody asks me the same question, when to join the class. So like there is no specific like time that you need to join in third, first, you need to join in your second year or final year or internship. But I chose during my internship period because I was like sure about my preparation during my second year. I was able to do most of the things from the review books with respect to NEET preparation. So my idea of joining my basically taking decision to join in future in the internship was I wanted कि मेरा in 1 year of internship, I knew that my internship is not going to be very hectic. I would be able to manage that. In 1 year of internship, by doing the regular class of whole 19 subjects, I would like get the overview of all subjects. I would be able to revise all 19 subjects in a short period of time with the help of the class. And what you get from the class, they are going to be the class notes. I would say notes are going to be the most important material for a preparation during your internship or post-internship whenever you are preparing for your NEET. They are going to be the most important things. Why I am saying that? Because as of now, most of the students, like I would say 90% students are joining any of the class. Everybody is reading the class notes. Like, you may join any class. I joined Bhatia, you can join DAMS. It's no issues with that. It's just personal, individual choice. So joining class is not necessary, I would say, but like it is always going to be helpful because there also you are basically taught by the subject expert faculty. So basically they will in a short period of time, 5 days, 7 days, 10 days, depending on the subject, or even 3 days, depending on the subjects, they would take you through the whole subject. So if you have read those subjects before also by your own, by reading the textbook, it would be very easy, to understand those subjects, and like many things would now make sense for you that you read during your while reading the textbooks. So they have advantage that in a short period of time, if you are able to manage your time during your UG period or even after that, every weekend 2-3 days continuous lecture are there, 10 to 12 hours per day. If you are able to manage that, it is definitely going to be helpful. But as I said, even if you don't join class, you are not able to manage joining the class. And if you are comfortable, the last option is definitely going to be at least get the class notes which are available from your friends. That's the last option available if you are not able to manage the class during your internship or before internship. Because I know like attending the class and making your own notes is always going to be much better than that. But like then having something in hands is better than having nothing. So please, that's the last option I am saying. If it's possible, I would say, again say the same thing, it's not necessary to join the class, but if you join the class, it's always going to be beneficial. So, now, as I said, these are the 3 ways of preparation apart from reading textbook during a UG period. So videos, I would say it would be as per your own convenience, you can go through those videos, but then it requires a much amount of self-motivation and managing your time by your own. It's very important. So if you're able to manage that, seeing the video series during a UG period, I'm not saying that all subjects at a time in 1 year. Respective years mein hi, you have to see the respective subject videos. Like in second year, see the videos of pharmacology, pathology, microbiology and forensic medicine. Like it's doable, it's possible if you manage your time. Or else, as I said, you have always the option of reading review books, but going to 3 things or 4 things, it's not going to be possible. Select one best way possible for you during your UG preparation. So this is what is about my pre-internship preparation. Now during my internship preparation, like I know most of the South Indian colleges are having very hectic internship. I agree to that. You won't be able to get too much time for reading, for preparing for the NEET. But I was lucky to have a relatively light internship in my college. It was not very hectic. I was able to manage my classes as well as reading regularly. So it's individual, it depends on your college. So if your internship is not very hectic, it's not very you won't be able to manage them. If it's very hectic, then I know it won't be possible for you to join the class at that time. Won't be able to read very well with time. I know that. But then you should never lose hopes. You should never think I will take a drop and I will read after my internship. So that thinking is there in each and every mind. You should just be more self-confident, more self-motivated by your 4.5 years preparation, and then just at least the basic thing, the simplest thing I would say to do during your internship is just at least do 2 things. Give as much test as possible. I would say about it a little bit in detail afterwards. Give as much test as possible during your internship period, and also please go through the class notes thoroughly. Class notes are not going to be a very big deal, but it's important. It's not just important to go through the class notes. It's more important to understand what is written in those notes, because everybody is going to read the same notes. Everybody is reading the same notes, then why not everybody is getting the same marks? It's just level of understanding. You need to go through those books. You should revise those notes very properly. So if you are at least these 2 things, if it's possible for you during your hectic internship, do this. I was able to manage doing all the 3 things that is required, solving as much MCQs as possible in the form of online question bank of Marrow that I joined during my internship. Giving as much test as possible and reading the class notes as much as possible. Now for class notes, the notes, what my way of preparation during my internship was, as I was having 10 months of period before my NEET examination to prepare. So it's very important that when you are reading the notes for the first time, it's important to give as much time as you to give each and every subject more time than is required. First reading should be very extensive one. You should you should be solving the MCQs. You should be giving the test of those subjects, and add on the points in your notes, which basically you are having already with you. So during your first, I would say 5 or 6 months, your first reading should ideally get over if it's possible for you. During your first 5-6 months out of 10 months of preparation, you should be able to it's doable. It would be done. Notes are not a very extensive thing. They are very concise thing. You would be able to do that. But as I said, it depends on how much hectic your internship is. So when you are reading the notes for the first time, please make a habit of adding important points from the question that you are solving, question bank, from the MCQ books or online platform, from wherever you are solving the MCQs, to add the important point from that. And also it's very extremely important to go through all the tests available during those 10-month period. I gave the I joined the Marrow test series, and I gave each and every test of those whole test series. The disadvantage of Marrow test series would be as it's a new thing, it's just 2-year-old now, it's not having that much number of competitors. So for me, I was much comfortable with the platform of Marrow online platform. But then if you want a better competition, for that, so you can select Ames or Bhartiya test series. It's up to you. So if you have joined any of the class, you would be having that test series available for you. But if that's not the issue for you, then Marrow is going to be enough. Don't go through more than one test series. At least complete one test series if you have time, so you can give the free tests of other if it's possible for you. But please do go through whole test series of at least one source completely. So test series will be containing 2 types of tests. One would be the grand test. They would be from the whole 19 subjects, whole like 300 questions, the same pattern as like they are asking in NEET. And other would be subject-wise test, which would be divided in 2, 3 or 4 tests based on the length of the subject. So for grand test, now many people think when I will read, when I will complete reading my one-time reading after my 5 months, 6 months, 7 months, I will start giving grand test. But that's completely a wrong idea, wrong method. Please, like you have read during your 4.5 years. It's not like everything is new for you. Please do give grand test from your first month of preparation only. Don't think कि अभी तक मेरा ये subject बाकी है. Don't think like that. Please start giving the grand test from your first month of preparation. Like I would recommend to give at least 8 to 10 grand tests during your whole 8-10 months of preparation. This is the minimum I would say. If you are able to give 4 or 5 more, it would be more beneficial. What advantage you get by giving test is, when you give grand test, first advantage that you get is after giving this many grand tests, when you are appearing for the actual NEET examination, the fear of that anxiety that you have to attend the 300 questions in 3.5 period, the time management, then how many number of questions to attend, what about negative marking. This all things will get sorted out, will get clear if you have given this much number of grand tests. Second thing, the second advantage you will get is you will know the weak areas. So you will know the weak topics of yours, you will know the weak subject in which you are. So if you find you are getting continuously you are getting questions wrong from one subject, then you can basically review that subject again, revise that subject again more. And now in between I would also I forgot to mention one thing about the how was the NEET-PG paper this time. As Thameem sir earlier said, the same thing I am going to say. As compared to Ames, it has less number of clinical questions, more number of factual questions, more number of memory-based questions. But still, this time paper, I found most of the questions, I'm taking most of the questions were from the topics that we usually read during our UG period. They were nothing like out of the box question that are unexpected. Even memory-based questions were also like those which we usually read. They were from the topics we usually read. They were not out of the box questions. Also, about the image-based questions, there were at least about 59 image-based questions out of 300. So, and for image-based also I would say simple one thing. The images are not going to be something very new. They would be from the topics that you are routinely reading. It won't be from something like out of the box thing that you have never seen, you have never heard of. So whenever you are reading the topics, like for example, if in obstetrics you are reading endometriosis, you are reading adenomyosis, go through the images of those, gross images, radiological images, go through the histopathological images of those subjects, of those topics. So basically in exam only these questions are going to come in the form of images, image-based questions. Then, so like, the questions in the exam, they were like more of routine questions like that we usually see routinely, we study routinely, but they were not in the form of extensive clinical scenario. They were just giving 2-3 hints to the question, to the answer, and they wanted the answer. They never give whole 5, 6, 7 line clinical question and expect the answer. They will give 2-3 important points about that disease and they will expect the answer from you. So this is where the class notes are going to be helpful. It's like many people think class notes, I've read the class notes, now I know everything. It's not like that. You need to think about each and every point written in the class notes. Even the age, if it's mentioned in the class notes for some diseases, it's going to be a great hint in your exams. You will realize that when you give as much test as possible, when you give your first test, and when you are going to give your last test before the NEET, you would see the difference. You would see the difference in the approach that you are basically approaching each and every MCQ. So, test practice, MCQ practice in the form of test series as well as the question bank. I joined the question bank of Marrow. The question bank of Marrow basically they are subject-wise and topic-wise things. So, you will be able to revise those topics very easily from those questions only. So this is the way I prepared. Now if your internship is hectic, you are not able to manage reading, you are not able to get good ranks in NEET, it's okay. It's not your fault. Make your target after the internship, post-internship, that 8-10 month, 1 year period that you would be having. So that is the time you would be very free. You don't have any work to do. You have to focus only on your next NEET-PG. Make your goal, make your dream that I want to crack this year NEET-PG with as much good ranks as possible. So during that time period, after your internship, like it would be like 5.5 years of whole MBBS, and after that you would have forgotten many things, no doubt. So that time, apart from this class notes, question bank and test series, you can also, because at that time you will be having time, as you are free, you don't need to work. So at that time you can actually go through review books, topics on the review books of some subjects which basically you are weak. You think I have forgotten everything, you can basically review those, you can review that subject from the review books. It would be very helpful. So this was the way I prepared during my internship, during my before internship. But finally, the most important thing in whatever field you are, whether it's medical or engineering, there is something like interest of the subject is something which is very important. If you don't have interest in the subject, if you do not have passion for your subject, for the subject, whatever you are reading, then you won't be able to give your best for that subject, and you won't be able to like excel in that field. So like as here all are in medical field, now you need to love your subject. Even if you don't like the subject, please try to develop interest. But once you develop interest, sometimes what happens is like we read by ourselves and we are not able to understand that topic, and we are, ये तो मेरे लिए बहुत difficult है, समझ में कुछ नहीं आता. So at that time, please take the help of your seniors or faculties to make, or even your colleagues. So I would say at this point of time, the best way to prepare, the best way to remember, the best way to understand for long term is like teaching your colleagues, teaching your friends. Please make it a habit of reading the topic, because when you are like reading a topic to teach somebody, you need to first understand well. So for that you will concentrate more on that topic. So if you will read the topic with more concentration, you will try to understand, and then you will teach others, your colleagues or friends. So it would be a long-term memory. If you just read the books, then there are more chances that you will forget, and if you teach that topic to your colleagues or friends, it would be like a long-term memory for you. So, so it's like very important to develop interest. And for me, like I never hoped like I would get first rank, but that's like not, I always had a dream of getting like single digit rank. It was my dream to get that rank. It's not possible that I was able to achieve. Anybody can achieve that dream, but like you need to see that dream. You need to you need to set your goal as high as possible, as I said earlier. So if you give your best in the subject, if you develop interest in the subject and give your best, this is what we can do, and then leave the rest on the Almighty Allah. Inshallah, Allah will help you. Allah will help those who have done hard work. But again, the same thing, there is no alternative to hard work. You need to do hard work. You need to read in a smarter way, in a better way, not just blindly following others. You need to work out, like as I said, you have many options. You need to work out what works best for you. So this is what I have to say now. And also, now somebody would ask me, कि कितना पढ़ना चाहिए, how much time, how much number of hours you need to study. So that's very individual thing, I would say, because there are some, everybody know their own capacity. There are some who would be able to like complete the one topic in 1 hour, 2 hours. Other won't be able to complete the topic in 1 hour, 2 hours. So I would say it's quality reading which is very important. It's not just like quantity, amount of time you study. Also, by quality reading, I mean कि it should be completely devoid of any type of distractions. By distractions, I mean the smartphones. These are the most important distractions which all we are having. So when you are reading, please do only reading, nothing else. Even if you are reading from your phone, smartphone, please do not do any other things apart from reading, because our mind cannot go through multiple things at the same time. So when you are reading, do read only, don't do anything else. And also, as a Muslim, I'm a Muslim, I would very strongly advise my Muslim brothers and sisters, or any Muslim, any non-Muslim or Muslim, it doesn't matter, to have complete faith on your Almighty. And as a Muslim, I would at least recommend to at least the 5 times namaz at least to follow that completely. Never compromise on that, please. So it's always going to be helpful. It would be giving you mental peace. It would be a stress reliever. It would basically give you breaks during your studies. So this is what I had to say. So this was the way I prepared my whole UG and internship. I was able to get good rank during my internship only. So if anybody is having any sort of questions from your side, please.
यहाँ पे सवाल जवाब का सिलसिला चलेगा। उससे पहले बीदर की एक बहुत ही अजीम पर्सनालिटी हमारे पास है, लकीली ग्रेट पर्सनालिटी अजीम कुरैशी साहब से मैं ख्वाहिश करता हूँ कि वो यहाँ तशरीफ़ लाएं। अजीम कुरैशी साहब के घर में 9 डॉक्टर हैं, जिसमें से 6 MD हैं। पहली बच्ची इशरत गुवाहाटी से MD कर ली। उसके बाद नुसरत चेन्नई से MDS कर ली। उसके बाद अकरम कुरैशी का अभी मैसूर में चल रहा है, नाजिया बेंगलोर में है, उनके बाद की बहन BDS कर रहे हैं गुलबर्गा में, और छठी जो है बीदर में 2nd ईयर में मेडिकल कॉलेज में है। एक बहू MD है, मैंगलोर से तशरीफ़ लाई है, और एक दामाद MD हैं और एक दामाद MBBS हैं। इस तरह से 9 घर में जो है डॉक्टर्स हैं। एक बड़ी पर्सनालिटी हमारे पास है, नाम है अजीम कुरैशी। अजीम मीन्स ग्रेट, माशाल्लाह। मैं अशरफ केसरानी और उनके वालिद मोहतरम से ख्वाहिश करूँगा कि बीदर शहर की एक बड़ी पर्सनालिटी अजीम कुरैशी साहब की गुलपोशी और शालपोशी करें। अजीम कुरैशी की मिसाल को देखकर माशाल्लाह बीदर और उसके अतराफ़ में कई बच्चों की हिम्मत बढ़ गई है, और ये पूरे मुल्क भर में एक रिकॉर्ड है। मैं चाहूँगा कि अजीम कुरैशी साहब सिर्फ 2 जुमले जो है यहाँ पर इजहार ख्याल करें। जी, क्योंकि वक्त भी हो गया है, 5 बजे हमको प्रोग्राम मुकम्मिल करना है और 5 मिनट बाकी हैं, 2-3 सवालात हो सकते हैं।
What? See, I'm telling you this based on my based on the faculties that I have been exposed to. As such, as of now, as we all know, MD, with respect to practice, MD and MDNB are going to be equal. The only difference that basically we are told is DNB people are not allowed to go in the educational institutions. That's the only difference. And DNB as such, it's basically for those private hospitals who want to have the post-graduation course. The good part of the DNB exam that basically I know about is they have centralized examination board. NBE conducts exam for them, and that exam is difficulty of the exam is just much more than the MD examination, that which basically we have been told in that way. So it's not obviously there could be a difference between with the DNB and MD in terms of the exposure of the patient that they get, because private hospital hai, and in MD most of them have government hospital. But then it depends on the individual institution. It's not very general statement. And one more thing, earlier for DNB there were different exams, but from last year, for DNB admission in the January, for this session, for the after Feb March the DNB starts. For that session, it's basically based on the NEET examination only. They are going to make the merit list. There is no separate exam for this DNB during this period, but there is a one DNB exam during the month of July, June or July, for the admission during that part.
Hello, Assalamu alaikum.
Walaikum salam.
Congratulations, sir.
Jazakallah.
Sir, how to avoid sleeping during studies?
What?
How to avoid sleeping during studies?
So, avoid sleeping. First thing important is to take adequate sleep every day. At least 6 hours of sleep. 6 hours of sleep is enough, and you need to take 6 hours of sleep. May it be anything. You should never compromise on sleep. If you sleep for 6 hours about every day, and then usually we sleep during our studies, the only reason is we are getting bored with that subject. That is the only reason we get sleep. If we love that subject, if we read that subject with passion, with interest, I don't think we are going to sleep. Simple thing.
Sir?
क्या आप डैम से क्लासेस भी अटेंड करेंगे?
मैंने बोला ना, मैंने
और क्या
आगे बोल, फिर से बोल देता
दूसरे क्या स्टूडेंट्स को फिर अटेंड करना जरूरी है?
Sir, how to stay self-motivated?
Yes, excuse me.
How to stay self-motivated?
How to
Stay self-motivated all time.
see?
Self-motivated,
Yeah, I got it. See, for self-motivation, first and foremost thing, never think that this is not achievable for me. In whatever field you are, here most of them are in medical field, and I am also from medical field. If I say with respect to MD/MS for NEET examination or any other entrance, never think that I can't do this thing, I can't do that thing. If you have very high goals set in your minds, there are always going to be time when basically you will feel low कि आज मुझे ये भी नहीं आया, I'm not able to do this, that. But that's temporary thing. The real exam is going to be far afterwards. It's going to be very it's not the final exam. It's possible that you get some less amount of marks in some test that you are giving. It's possible. But then that's not the final exam. You need to correct the mistake that you have got in the test. And what else? Obviously, to go through some motivational speakers, it's always going to help you. That's helpful. But personally, I won't recommend any self-motivation in the form कि मैंने कोई specific किसी की speech सुनी नहीं है उस form में. But yet, it's always a good idea to hear from some motivational speakers.
Assalamu alaikum, sir.
Walaikum salam.
So I would like to congratulate for your achievement here.
Shukriya.
So my thing is that how to revise the whole of the syllabus of we are NEET UG students.
How to
So
revise?
how to have a revise at the end of these 2 months?
You are talking for the NEET purpose?
NEET UG.
NEET UG or PG?
UG.
Okay. Like, for NEET PG, if it's possible to revise in 2 months, why not UG? Simple. See, even for NEET UG, they are going to ask you the same things that you have read during your 11th and 12th standards. They're not going to be the things that you have never read about. But for last 1 month, 2 months preparation, you always need to have some concise material which will give you the insights, like overview of whole subject. And secondly, during those last 2 months, you need to focus on those topics, those subjects in which you are weak. So for that, you basically need to make a note of those topics in which you are weak at, and give more attention to those topics, to those subjects during your last phase of preparation. And also during last 2 months of preparation, I would say in the last 2 to 3 months of preparation, it's important also to give few tests which will basically help you where you stand as of that time.
Assalamu alaikum, sir.
Walaikum salam.
Sir, we want to know how to cope up with stress and how to not let stress come in between our studies.
See, for stress, I believe one simple thing. Everybody is going to get stress, no doubt about it, because this field is going to be like that. But having said that, what I feel, like if there is some low levels of stress, it's going to be helpful. How I would say, see, suppose we are having exams, so we get stress of the exams, and we take it positively in a way that we read more during our exams. But if the stress exceeds its limit, it's going to harm us. So as I said earlier, for me, like to basically devote my some time to the religious things, it always helped me to like keep my stress level to as low as possible. And second thing, many times we get stressed because we tend to compare ourselves with our friends. Please don't compare. We're not competing with this. It's okay if somebody else is getting more marks than you. That is sometimes the reason we get stressed. Please don't compare yourself with anybody. Give your best. If you are giving your best, then like you won't be having any issue for that.
Assalamu alaikum, sir.
Walaikum salam.
Congratulations for your success.
Shukriya.
Sir, my question is that though we have prepared since from the beginning, but just before 2 days or 1 week before the exam, when we are preparing for that topic, we think that we have never read it. We come to a lot of tension. So what is the remedy for this?
Okay. During your NEET-PG preparation, actual 10-month preparation, what I did was, I read for the first time during the first 6 months. The second time reading, first revision was in next 2 to 3 months, and last revision was in about 3 to 4 weeks. So it's very important during your last phase, last 2 to 4 weeks period, to have a very concise material for preparation. And also, in the last few days before preparation, before the actual examination, you need always have a habit basically to note down the things which you which basically have to be remembered, which are factual things. If it's something for conceptual thing, understanding thing, if you have understood it well before only, it's okay if you don't revise it just before exams. But for the factual things, memory-based things, you need to make a list of those topics to basically have a last look just before the exams. It's not possible to read 19 subjects in 1 day, 2 day, 3 day. But yes, you need to have such notes which you are able to revise in last 2, 3 or 4 weeks. Because the revision is, finally it's going to be the revision of the all 19 subjects in your last few months, which is going to be actually helpful in your NEET examination. So as everybody says, read only that much which you are basically are going to revise in last 3 to 4 months. Okay. So one question is about the class, whether to join the class or not and when to join class. So as mentioned, I joined the class during my internship period, though it's not necessary, but if you join the class, it's definitely going to be helpful, no doubt about it. But only thing is you should be able to manage your timetable, manage your time to basically have a time for that.
जज़ाकल्लाह अशरफ केसरानी साहब का। और आज इत्तेफाकन यहाँ पे हमारे 2 एमडी डॉक्टर हैं और बल्कि बहुत ही पुराने ज़माने के हैं, बिल्कुल इब्तदाई ज़माने के। डॉक्टर शरीफ से ख्वाहिश करता हूँ कि यहाँ तशरीफ़ लाएँ। और डॉक्टर अबरार, डॉक्टर शरीफ शाहीन के पुराने दोनों एमडी हैं, एमडी मुकम्मल किए हैं और खुशकिस्मती से बीदर में प्रैक्टिस कर रहे हैं। दोनों की गुलपोशी और शालपोशी यहाँ पर होगी और इसी के साथ हमारा ये प्रोग्राम जो है इख्तिताम को पहुँचेगा। डॉक्टर अबरार उस ज़माने में एडमिशन लिए थे जब शाहीन में बहुत ही कम स्टूडेंट आते थे, तो इनके अंकल जब पकड़ के लेके आए थे इनको शाहीन में, तो ये बड़े परेशान थे। पर 4-6 महीने के बाद उनको एहसास हो गया कि मैं सही जगह पहुंचा हूं, कॉन्फिडेंस बढ़ा, पढ़े माशाल्लाह। बीदर मेडिकल कॉलेज में आपका बीदर मेडिकल कॉलेज में MBBS मुकम्मल हुआ और बेंगलोर में किम्स से MD रेडियोलॉजी आपका हुआ है। डॉक्टर शरीफ निर्ना से हैं, उर्दू मीडियम से जो है 10th तक पढ़े, बल्कि घर से 12 किलोमीटर दूर जो है जाकर हाई स्कूल करे। 8, 9, 10 12 किलोमीटर दूर साइकिल पर जाकर पढ़ते थे। सिर्फ शाहीन में एडमिशन लेने की ख्वाहिश में 3 साल मेहनत करे, 8, 9, 10 और मौका मिला और 2 साल के बाद ही बीदर मेडिकल कॉलेज में एडमिशन मिला आपका। बीदर मेडिकल कॉलेज के फर्स्ट बैच के स्टूडेंट हैं और MD आपका हुआ है किम्स हुबली से MD करे हैं और अपनी पैथोलॉजिकल लैब का इनाग्रेशन 8 दिन पहले करे। और हमारे एक स्टूडेंट डॉक्टर फाजिल खान की क्लिनिक का इनाग्रेशन MD हैं वो भी, उनका भी इनाग्रेशन जो है एक 5 दिन पहले हुआ। मैं आउट ऑफ बीदर था, वहाँ पे इनाग्रेशन में जा नहीं सका। मैं ये तमाम डॉक्टर्स को को मुबारकबाद देते हुए अशरफ केसरानी साहब और उनके वालिद साहब यहाँ बड़ौदा से यहाँ पे तशरीफ़ लाए और कल हैदराबाद में 3 बड़े प्रोग्राम हैं, वो यहाँ आए, तकलीफ़ बर्दाश्त करे हमारी दावत पर। मैं इनका शुक्रिया अदा करता हूँ और उम्मीद करता हूँ कि हज़ारों बच्चे इनसे मोटिवेट होकर ये सारे कोर्सेस करेंगे और हमारे प्यारे प्यारे बच्चे जो है डॉक्टर्स बहुत दिनों के बाद देखने में मौका मिला आए हैं और कई बच्चे जो है अपने अपने मुकामात पे ऑनलाइन ये प्रोग्राम देख रहे हैं। फ़िलहाल उन तमाम को मुबारकबाद दूंगा और कहूँगा कि मेहनत जारी रखिए, सेल्फ मोटिवेटेड रखिए और टारगेट अच्छा रखिए, इंशाल्लाह सारे के सारे सक्सेसफुल रहेंगे। बहुत बहुत शुक्रिया। अल्लाह हाफ़िज़। अस्सलामु अलैकुम वरहमतुल्लाहि वबरकातुहू।
बॉयज़ बैठे रहें, फर्स्ट गर्ल्स जाएंगे, बॉयज़ ऐसे ही बैठे रहें। फर्स्ट गेस्ट को जाने दो।